all. Good evening, dear students. Hope you are all doing fine. So, it's my great pleasure to introduce you all to Dr. Shirisha, who is a very renowned dentist, and she has earned her bachelor's, that is BDS, from Geetam Dental College, and then she completed her MDS from Vishnu Dental College. And later on in 2018, after relocating to United States, she completed her INBDE step 1, step 2, and all the steps, and got her admission in University of Colorado in dental medicine, where she successfully graduated in December 2023. And since 1.5 years, she is currently contributing her expertise in PDS dental organization and working there since past 1.5 years. So today we have her with us to share her insights and expertise for INBDE exams and all, so that she can guide us all to clear the exams further and to build up all your bright futures. So thank you, ma'am, for joining with us in a very great morning. It's early morning there, and she's there with us at morning 5 o'clock or morning 6 o'clock, ma'am. So she is with her. So I think, ma'am, thank you for giving your insights, and hope we learn a lot from your session today.
Okay, thank you, Raina. Hi, everyone. So as Raina said, I graduated in 2023, and since then I've been working. So I'm just here to share my experience and see if you guys have any questions. I'll be happy to answer them. So I am assuming like most of you here are still planning to move here, or I mean, some of you might already be here and planning to do all of this. But just before we start, I wanted to let you know that usually out of 100% people who move to the US and who try to apply to this program and graduate, 80% are successful. When I say 80%, that's a huge number. And the remaining 20% are not successful. I mean, just because the perseverance is not there. So anybody can do this is what I'm trying to say. If you have done BDS there, that's it. You can graduate the program here. The only thing, the tough part for me was getting into school. So once you get into the school, I think everything is smooth and nice, and you'll just finish it. It's the money you are investing in it, right? So that's the main criteria. So getting into the school is tough part, and paying your fees for your dental school is the tough part. So two things here. So paying your fees, that's a whole second scenario. So we will deal with it when we come to it. But just getting there, I would say yes, INBDE is the first easiest step according to me. So when you're studying and starting your process, I want you to think long term. When I say long term, like how many years are you capable of investing in all of this, right? So for me, it took 3 years to get into the dental school. So I worked at least 2 years for me, when I did my NBDE boards, it was 2 parts. So it took me an year, 6 months and 6 months to clear both. And then 1 year I took to prepare my SOP, do the resume, and all of that. Again, I started all of this while starting for NBDE process, but I wasn't good at it. And then I had to redo it. I applied for my first cycle. I was not able to clear. And then I did my second cycle. That's when I got an admission. So again, getting an admission is something you will, in the end, you will get an admission. It's just, is it taking 1 year, 2 years, 3 years? So that is why I want everybody who wants to do this path to be clear that it is a time-taking process. For some people, if you're lucky, you just get it in 2 years, right? 2 years is at least the minimum, because even if you get an admission like right today, it takes at least 6 months for you to join school, because that is how far prior all this process happens. So you want to make sure you have a base in the US. So if you're planning on giving NBDE exams and moving here, try to establish that base before, which is very important. It's not easy just coming here, paying all your expenses and all of that. I had my support from my partner, so I was able to do it. So if you have your partners, make sure you talk to each other. This is very important. I know getting into this program, doing it is the easiest part, but all of these outside the process is the tough part. Yeah, just to begin with, as I said, INBDE, I keep hearing about it, but as personally, I took the NBDE 2 parts. So when it comes to this exam, I was not like referring to a lot of books, but rather I stuck to one book, Dental Decks. That's it. That. So for me, it was read that one book multiple times, revision, revision, revision. That helped me. Again, as I did my BDS a long time ago, it was all new for me again. But if you're a recent BDS graduate, just try to clear out this NBDE as soon as possible because everything is already fresh in your mind. You don't have to sit down and study again and again. So, and one more thing before we go into this NBDE and the process is if you're in your internship, just make use of that time. Okay, because again, as I said, time is very crucial here. INBDE, as soon as you can, just clear it off. And then the process takes a while. So in the process is when you do all of the shadowing, assisting, or preceptorships, anything that you want. So like now let's say you're in India versus let's say you're in the US. You're in India, I know you have to move to the US or Canada to give this exam. So since it's a 1-part exam, make sure you have your timeline set. Unless you have a date for the exam, at least for me or people like me, unless I have a deadline or I have a date for the exam, it's tough for me to prepare my timetable. So that is how it helped me. Like every time I set a time, and based on that, I prepared my timetable. Again, it's not the tough part. It's just about revision. It's just about how much or how many times you're reading the same thing, because nothing is like logical thinking or nothing math where you do math, I mean equations and all of that, right? It's all about remembering stuff. It's all about biochem, biostatistics. At least for us, biostatistics was not too much, but I heard as time went on in the past few years, even biostat, like they were giving a lot of questions out of it. But as far as the clinical part of the exam goes, for me, that was much easier than the basic part, because basic part was all microbiology, biochemistry, physiology, where I was not, everything was out of my head and I had to redo all of that. But again, that is the reason I say do it as soon as you can. Even if you're in internship, just do it. Do INBDE and then remember the process time, right? So once your INBDE is cleared, this takes about, for me, it was $600 and $600. So overall, it was a $1,200 for me for the exams. So if you want to prepare for those exams, stick to one book. If you're already in Conquer, you have the Conquer book, stick to it. If you're already using some other books, stick to it. So just stick to that one book. Don't try to listen to other people when they say, oh, this book has this information, your book doesn't. No, that doesn't matter. One question doesn't matter. It's overall. It's not like a mark-based exam, right? It's like a pass or fail exam. So you don't have to worry about getting the highest score, but rather do it fast and make sure you pass. That's it. And there are, if at all you want to understand more perspective into it, you can also join, at least for my exams, I had a lot of Facebook groups, like you can just search INBDE groups, INBDE 2025, so that all the recent people who are giving me their INBDE exams would be there. That helped me very much because people share their questions. And that's how you know where the exam is concentrated mostly on. And also, there was a time where the question pattern was very similar for a few months. Like, let's say I'm giving my exam today, the next 2 to 3 months, the question patterns were the same, if not the same questions, patterns were same. So it's very important that you also understand what the recent exam takers are putting out, like in Facebook groups, or if you have personal friends, or if there are some people in MDS CONQUER, maybe they can share with you. So that very much helped me. So revision, stick to one book and follow these groups, or if you have personal friends, make sure you know what kind of questions you're getting there. People are very generous in the Facebook groups. They do share a lot of questions. So these three things help me. And after the INBDE process is when the actual money investing starts. I would say at least put $3,000 to $4,000 aside for all this process. Again, if you apply to one school, you get admission to one school, wonderful. But that's not how it works, right? It takes a little bit, and not everyone can get the admission at the same time. So put that aside, $3,000 to $4,000 minimum. Why? Because every school has at least a $300 to $400 of admission fee. And when you do this, before you just go in, there's a site called CAPID, CAAPID. When you go to the site, you have different schools. But that's why I said, if you are already in the US, it's much easier for you to decide which areas are you going to. If you're already located in a place, like let's say I'm already in Colorado, I try applying to Colorado schools and wherever I want to go. So again, don't apply to a school where you think you might not go. So just make sure if you're applying to a school, you are going there. Most of the schools are in good locations. It's just the area. Like are you okay going there? Are you not okay going there? So for me, California was something I was not okay going to because of the cost of living. But then I still applied because California has a lot of schools that offer dental program, international program. That is almost 5 dental schools. So that was a lot. So I didn't want to miss on it. So this is how I want you to categorize. So first, categorize the number of schools you're applying to. There will be at least around 40 or 35 to 40 schools that offer this program, and you want to choose a minimum of 15 to 20. Even if you get someone to tell you, hey, no, don't just apply, keep applying to these 3 schools and you'll get in some time. No, don't do that, because that 1 year is worth your money. Even if you're investing that $2,000 this first year just to get into a dental school, just think of that later, that 1 year you're going to be earning money as a dentist. So don't think about this $300 and $400 you're investing in in this process, but the time is the key here. Time is key. And different schools, that is the first thing. Location. Second thing is different schools offer different time frames. Like some schools are 2-year programs, some schools are 2.5-year programs, some schools are 3-year programs. So again, that is a personal decision. I personally didn't want to go to a 3-year dental school. So I didn't apply to Florida because Florida is a 3-year dental school. So that way, I kind of categorized. I'm okay with 2 years and 2.5 years. So that's the second category you want to take into account, because the more the number of years, the more the fee, right? So, and the longer the program is, the later you come out of, you graduate. So there I considered like my best investment was in 2-year dental programs, because that is the minimum where schools do. So that's how you categorize location and then the time frame of the program. And the third comes the fee structure. I may be comfortable with 150,000 US dollars. You may be comfortable with 200,000. Someone may be comfortable with 500,000. So again, it's a personal choice, a personal decision. Even the fee structure is given very efficiently in the website. So I want you to take a look at it, because this is very important. Are you okay burdening yourself with that much amount of loan when you come out, right? So that is very important, according to me. So that is when you want to make sure you take these 3 columns and categorize the schools that you want to go to. The east side of the US, which is the New York, Pittsburgh, Pennsylvania, they have many dental schools which offer international program because of the international crowd there. And the same way, California also has at least 5 dental schools that offer this program. But the rest of the states, they have like one each here and there. So this is the second step. You clear your INBDE. It's at least $1,200. Put that aside. And then the process of all of this, admission, everything, $3,000 to $4,000 aside. And categorize, apply to at least 15 to 20 dental schools. You getting an admission in the first cycle is very, very valuable. Okay. And the third thing is you want to prepare for what if you get an interview or what if you're going to a bench exam. So this is where you want to be preparing for the interview questions. You want to be preparing for the bench exam. So again, when I did my admission process, I did in 2020 and 2021. So 2020, no bench exam because of COVID. 2021, some schools came back, so I gave bench exam in one school and no bench exam in other school. So now all the schools, they're again reverting back, having bench exam, most of them. There are some schools which don't do bench exam at all and they just go with your profile. So although you think you have good clinical skills, it is not about good clinical skills. It is about following the criteria the school is giving you. Like I'll just share what I have experienced, okay? So you do a class 2. Make sure you're not hitting the tooth next to it. Make sure you're sticking to the dimensions. They're not looking at how beautiful the curves are. No, they're just looking, are you maintaining the depth? Are you maintaining the width? Are you not hitting the tooth next to it? That's it. You pass. And then if at all 2 people pass and they have to choose one, then they may see which one is prettier. But that is very, very rare. Because when I was in dental school, and as I was talking to my professors who are in this admission process, this is what I acquired from them. Like, it's not about how beautiful your preps are. It's just about how diligently you're following the criteria they're giving you. And how does this come? Practice, 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 practice. So for me, I took interview classes because it's very different. You think you're doing it right, but it's very different getting a perspective. Even if you have family members who are good at this, talk to them, sit down with them, ask them to interview you. There is always a good set of questions for the interview, very basic. Tell me about yourself. What is the best thing in your life as a dentist? Why did you become a dentist? If not for a dentist, what would you have become? Some schools, they go more personal. Some schools, they stick to the profession. But it is better to be prepared, right? And the preparation for this interview is very important because this is where they see your language skills. And this is where they see how efficiently you're able to, collaborate your answers. Because in the end, they all know that we all have graduated dental school. We all have a certain level of dental skill, and we can just grow from there, right? It's not about the dental skill that they're looking at here. It's about how much you're communicating, how truthful are you? They actually look at how truthful are you. If you keep saying the Google answers, they know it because trust me, they have been doing this process for 10 years, 20 years, I don't know. But they know, they can tell who is telling the truth, okay? Even if it's simple, even if your life doesn't have many incidents which are interesting, that's okay. Just tell them. It's not important that everything should be unique in your profile. It's not important everything should be different in your interview answers, right? It's about how straightforward you are. Even if you have a simple profile like BDS, externship, shadowing, and did some CE courses, but I'm interested in this because I want to grow as a dentist here. But I mean, personally, this is where I am. I have a husband, I have a dog, whatever. So even this simple profile gives you admission. It's not that every time it has to be unique. That's what I'm trying to say. Don't try to strive for being unique. Like, if you are unique, that's amazing. If you have unique profile where you did different kinds of things, amazing. but don't try or don't thrive to be there. Okay, just keep doing what you're doing. What they are actually looking for in students is communication and consistency. When I say consistency, they know if you're a first time applicant or a second time applicant. If you're a second time applicant, they actually ask the question, why are you wasting one more year to apply to our school? Or why do you think you didn't get an admission last year? So this is how we want to be prepared. And when you are preparing for this interview, that is why sometimes it is important. If you think, at least for me, I felt like I needed that professional guidance. That is where I know where to cut my answers. I know how to time myself, because in this interview part, the main important thing is you time yourself. You can't just keep on going with one answer, because they have 20 questions for you in 30 minutes time frame. If you just keep talking about the first one, they know you have no time sense. So they evaluate everything. How are you timing yourself? How are you just sitting, your posture, everything? Are you just relaxing like this and answering questions? How is your background? Everything. They look at everything. So this is what I'm trying to say. Just don't think that, oh, this person has this, so I should do this. This is how they got admission. They have a preceptorship. So let me do a preceptorship and put $20,000 there. No. If you're really interested in doing the preceptorship, go for it. But just don't do it for the sake of building profile. The reason I'm saying this is in our class, we had 40 international students, and all the 40 people had different profiles. There were simple basic students who just graduated BDS and they came directly from India after getting an admission here. There are many schools that do this because they want fresh graduates, they want experienced people, they want younger people, they want middle-aged people, they want older people, they want females, they want male. So this is the diversity they are looking at, okay? But one important thing here that I experienced is you Indians are competitors to Indians, because we Indians are huge in number here. So in our school, out of 40, there were 25 Indian students. So we are competitors to ourselves. So that is what I want you to remember. Every time they try to take one from Pakistan, one Iran, one Persian, one Australia, everything. So every school wants to have that diverse community. So if you don't get an admission, that doesn't mean you're not good, but that means you were not in the top 20. That's it. So this is where I think the tough part is for me, as I said, the interview and the bench prep. So bench prep, again, I took a professional guidance. There were institutes here in the US. I took it from Stevenson Dental, Tuggen Dental, but I took online classes from Stevenson then, and Shrikant also helped me out. So all these three together, so I didn't want to give a chance. That's why I took whatever I could. Even if they're asking for $500 or $1,000, again, as I said, I had that leverage because my husband was working for me. So we thought, okay, investing this year is much easier than wasting one more year. So that is why I tried to invest my money there. So this is what I'm trying to say. Please think wiser when you're doing in this process. Do not waste your time. If you really want to be a graduate here, do the DDS and practice here, just make sure you're doing it quicker. And one more thing, with the visa processing currently, I know the student visa process, H1 process, everything looks like it is very tough. So I also want you to consider that. I'm not saying do not come here. I'm just saying look into the recent news, like whatever the US, it's called USCIS. So whatever news they're sharing, look into it, okay? Don't just follow Facebook posts where they say the F1 visas are tough now, do not apply. No, don't follow those, but look into good websites, like the actual US government website, okay, if you're really curious. Because they are trying to make some changes for sure. They're trying to maybe limit the H1 visas in the future. I'm not sure, but that is what we keep hearing. Again, all this is, I don't know, I'm not sure. So I want you to guys to think about that as well, because what if you invest your time, your money, your sweat, everything, you finish DDS, and what if getting that visa is tough, right? So we don't want to end up there. But Even if the visas are tough, like for you, if getting a H1 visa to work is tough, you can still be a dependent on your partner and work. First option. Second option, you can go to organizations to work where they take you even though you don't have visa. Although you get paid a little lesser, but the experience is humongous. So there are ways you still can work here. I'm not saying visa is a big thing now. It's the last thing, but still more important to me because you want to stay here long term. I don't want to just invest that 200,000 and graduate DDS and then go to India and work because you're not getting the same amount of salary there and here. How are you paying your loans? So this is the whole process I want you to think about. Pen down everything. Pen down the time frame. Pen down the amount you're investing. And I didn't mention the dental school amount here because every dental school has a different fee structure, depending on the number of years, depending on the location, depending on which state you are. So for me, University of Colorado was like 200,000 US dollars for 2 years. But when I got admission at University of Washington, it was $350,000 for 2.5 years. So this is where I took a call, like, okay, I rather invest 200,000 because in the end, I know I have dental skills. It's not like I wanna. It's not like any school is gonna turn you over and make you the best dentist. No, no international program does that because they think you already know stuff. So they only invest in teaching you what is different in the US, not the basic stuff. So don't think if the school has good reviews or if the school has good reputation. In the end, international program is international program. It doesn't, according to me, again, it's a perspective. Maybe it's different from person to person. But since I am talking, I know that for me, the school was not important. The location was important. And if I could live there with my husband was important. And the fee structure was important because I didn't want to end up in a $350,000 loan. It was not for me. Again, you may be comfortable, the other person may be comfortable, but I am not. So this is the whole process. In between, if you're taking a professional bench course, I invested $4,000 to $5,000 for it. So again, just to brief out, a total of $1,200 to begin with, and then $3,000 to $4,000 for admission process, and $4,000 to $5,000 for the interview, bench course, and everything, and then a $200,000. So all of this is the money I invested in my career to build my career here. After I come out, how am I clearing the loans, everything, that's a whole different scenario. It's a very personal choice. So I'm not going to go there at this time. But okay, until now, I know I have shared, it's just like a brief path of what I went through. Just let me know if you guys have any questions. Someone asked me, could you tell the name of the book which you prepared from? It's called Dental Decks, and it had 2 parts when I was preparing. Since it's INBDE now, they should have turned it down into one big book. It had these sample questions everywhere, and under the questions, you had explanation for every answer. So I hardly referred to my textbooks when I had doubts, but otherwise I stuck to that book. There was also a book called First Aid. So I also referred to that book for some clarifications, but other than that, it was all dental decks. Any other questions or anything you want me to concentrate on? So that I can just go dive deeper a little bit into it. If you can put it in the group chat. Boot camp. I personally did not go to boot camp, but I heard it is still a good deal because you have people around who you are competing with and there are exams going on. I took an online I took online tests. I used to pay $20 or $30 for the test, and I used to take online tests. Like there was an NBDE web app where they conducted some tests. Again, they were not reliable, but I just wanted to not invest too much into my boot camps and all of that, because I already had some partners I was studying with. Again, if you're a person who likes to be in that groups, if you're a person who needs that competition, go for it. Again, how I got these people to work with was from Facebook groups. So that is why those are very important. You try to develop those relations there. You try to develop what other people are thinking. And you also see how other people are successful, which gives you motivation. So that is what I did. I did not go to a boot camp, but I heard they work. It's just, how do you like studying? Do you like being in a group? Do you like having partners? Do you want every week tests? All of that. Okay. How many attempts can be given in a year? Again, for me, when I was doing it, if we don't clear NPDE part 1, we should take at least a 3 months gap to give the next part. So I'm thinking it's the same thing. It shouldn't be more than 3 to 6 months. So in a year for INBDE, you should be able to give it at least 2 times. And criteria for TOEFL, that's a wonderful question that I missed. So TOEFL, again, it's important because, as I mentioned earlier, they're looking at communication. And they want to know that your English is decent. You don't have to be like a proficient American English, but it should be very decent where other person is able to understand, because you will be dealing with the patients who are Americans, right? So that is why they want you to have this proficiency in English. And as I said, Indians are competitors to Indians. So when they're looking at Indian, let's say they're comparing 2 Indian profiles, you passed INBDE, the other person has a good GPA. GPA is where they collaborate all your dental degree marks, and they give you a grade point average, which is called GPA, and it is around about out of 4, and out of, I'm sorry, I just forgot if it's out of 4 or out of 5, but usually Indians, yeah, it's out of 4, and the Indians usually have 3.8, 3.94, whereas other country people, they have 2.5, 3, 3.5. So then they look at your grade point average. Oh, this person has a 3.9, this person has a 3.5. And then they look at your TOEFL exam. And this is where I've heard, even recently when I was talking to people here, I knew that TOEFL is being tough for them to, or stopping them from applying to dental schools yet. So for TOEFL, at least a score of 105 or above is very important. That tells them, okay, you're fast and you're proficient, because TOEFL has all these steps: reading, writing, listening, talking, right? So, and it's, TOEFL was more tough for me than INBDE because it's a time-based English exam. Even if you're good with English, you want to make sure you're writing sentences, you're making up a story in that time frame. Time is the key there. Even for TOEFL, YouTube. I just followed YouTube randomly. Do not take, even if people are offering, they give you TOEFL classes and all of that, not worth it, because nobody is able to teach you anything in TOEFL, right? It's all about you practicing, practicing, practicing. There is no technicality here. So just keep practicing. And for me, YouTube was my only go-to. I just looked up for how to prepare for TOEFL, and I got some websites and I prepared from that. But other than that, I also had a book, a TOEFL book, like a little bit the TOEFL book, but I never touched it. So don't try to buy any books because they're not worth it. It's all about visually what you see and what you talk orally, right? So just don't invest too much in practicing for TOEFL. Again, in the TOEFL website, you also have practice exams. It was $45 to $50 for one exam, and you can give that. So that is how you know where you are at. Okay, that's very important. You, rather than spending $250 for an exam and then not clearing it or not getting the score that you want, it's easier to invest that $40 to $50 for a practice exam. Make sure where you are, and then go for the exam. So preparing for the TOEFL, start when you're doing the INBDE process, because it's not a one overnight thing. It's not a 2-day thing, right? It's just like you keep speaking, you keep talking, you keep doing it, you get more proficient at it. So that is where I stand with TOEFL. But yeah, minimum score of 105 to 110 is required, because all the Indians, they have that minimum score, and you have to be competent with them. The salary, is it worth investing that money? I would say yes, because again, it's a perspective. Like, are you, how much money is too much money for you? Okay, what is your background? Financially, how did you grow up, right? For me personally, I feel the salaries are still, if you like, let's say rural place, urban place, okay, you are in a city versus you are in a small town. You get high salaries when you go to that smaller towns where you don't have Indians, where you don't have Indian groceries, where it's just that white American people staying there, and are you able to deal with them? There you get a huge base of salary. City, the competition is very tough because there are so many Americans that are graduating every year. Just like in India, dental schools here, they take 80 students, 90 students, 100 students. So it's not us, it's the Americans who are also graduating. So when you're staying in that city, your salary is limited, but you have many Indians, you have Indian stores, you have groceries, food places, everything. So what you choose. So depending on that, right now I live in a city because my school was here and I'm used to this place. So the salary, when I was interviewing for jobs, when I was comparing the salary to city versus a town, was at least $100,000 difference. But are you wanting to go there is the key. But just to answer your question, yes, it is worth it. So TOEFL exam, as I said, give it after INBDE, because schools have a limitation on when you give the TOEFL. Some schools, they say it should be within 12 months before you apply, because what if you give 4 years ago and after 4 years you apply to a school and now they don't know what your English skills are at this moment, right? So that is why they give that time frame, 12 to 24 months. Usually some schools are 12, some schools are 24. But let's say every cycle opens in March until October, November is when the cycle runs. Some schools open in March, some schools open in April, September, October, November. So if you want to apply in March, at least for me, I took my TOEFL in February. I made sure, but in January I took once, in Feb I took twice. So I gave 3 attempts to reach the score that I wanted. In the first 2 attempts, I was in my 95, 96s, and I knew it had to be 100 and above for me. So the third time is when I was able to do a 108. So you will need multiple attempts. So start in January. What if you need more attempts? Okay. And always apply early to schools. That is the key. So that is why take TOEFL 2 months prior to when you're applying, and then go from there. Which time it is better to go abroad, UG or PG? It's a no-brainer, it's UG. I did my PG in India. I don't say they don't value your post-graduation, but they don't think this post-graduation is matching with the post-graduation in the US. And the reason why I say that is the teaching style is different, the patient experience is different, the techniques are different. So if you want to practice here, don't even think of doing a post-graduation there. Just come here. If you're already doing your post-graduation, that's okay. Finish it up. That builds your profile. And if you're practicing after post-graduation, that further builds your profile. So I'm not trying to deteriorate anybody here, because I myself did my post-graduation and came here. But you don't have to do a post-graduation to get an admission here. As I said, fresh out of dental school candidates were also there in my class. And there were 20 years experienced person who was also there in my class. So that is the diversity they look for. Don't just go with other people's profiles. That is what I'm trying to say. Just because the other person got an admission because he has a post-graduation doesn't mean they look at only that. They look at multiple. The reason they have all of these steps is they just don't want to stick to, one process. Not just what if everybody who passes INBDE gets an admission, right? They don't know how your dental skills are, so they want to look at your dental skills. They don't know how you talk, so they look at TOEFL. They do your interview. So they're looking at multiple things. So don't focus on getting post-graduation preceptorships just for the sake of it. So Australia and Germany, I am 100% not sure. But Australia, I do have a few friends who cleared the exams. And I did hear, even like, just like in the US, 90% of the people who move here from India, even including myself, I moved here because I know the earning potential is more for a dentist here. And I heard it's almost close in Australia too. And the work-life balance is still there. For me, these two are the most important things: work-life balance and money. So I just heard from my friend that it is similar. If you want to consider Australia, it's a whole different process. It's a whole different textbooks. It's a whole different preparation books. It's a whole different preparation for the practical exam, because they are very tough when it comes to the practical, because they don't have to go to dental schools, right? So that is why these exams are very tough. But it took my friend at least 4 years to clear out everything. She gave the exam twice, both the theory and the practical. She said it was like very tough, and you definitely need professional guidance when you're preparing for Australian, because there is no dental school that you go to. In the US, it is much forgiving because there are many schools that have this program. There are a lot of people who go into dental school. That is why they're not very tough when it comes to this bench exams and all of that. Germany, no clue. Sorry about that. And INBDE exam and TOEFL on B1 visa, or pursue MHA or MPH and then do the process. So I would say, if you plan on coming here and you think you can get into an MHA or MPH program, which is like a 1 year, not 2 years, but 1 year, take it. Because then you will have a base here. And even if you're trying to apply for dental schools, you'll have your own salary when you come out of the school, MPH or MHA, anything. So there are 50% of the people who do that. Like, as women, we have husbands working here, but if boys are coming here, they come in individually, right? So they usually do that, MPH or MHA, and they come here and do it, which is like fair. It also adds to your profile. And if you think you need at least that 3 to 4 years time frame to figure out the finances and everything, do it. There's no harm in not doing it. But if you have that support here, you don't have to do it. So giving INBDE and TOEFL on F1 is much preferred, because you already established a base here than B1. What if you give it on B1 and then they reject your F1 visa? See? So you don't want to take chances. So if you ask me F1 or B1, I would say F1. Letters of recommendations, LORs from India, strengthen up. Can we do to strengthen up resume? LORs, of course, the Indian LORs are valuable, Why I say that is they want one LOR from the person who you actually worked with in India. Because in the US, it is a very short experience that you have with other people, right? Indians are the one who have a long experience with you. But you don't want to write it in such a way that, hey, they're fantastic, they're amazing, there's no other person, there's no other dental student that I've witnessed just like her. No. Again, be fair, be more practical. For me, my one LOR was from my dental dean of BDS school, which is like a mandatory for every dental school. They want one from your BDS dental school, from the principal or dean. And our school has a set paper which they write, but I personally emailed my principal asking, can you add this paragraph for me? Because he doesn't know who I was. I graduated like 8 years, and then after 8 years, I text them and tell them, hey, I want a recommendation letter. He doesn't know anything about me. So then I told him, hey, we did this when I was in dental school. We conducted this program. We were more involved in this. We conducted these many dental camps, and I was in the top 10 to 15% of my dental class. Then he was like, okay, let me verify. I don't know if he even verified or not, but he added that for me. But one thing is, you don't see what those letters look like because the dental schools submit directly to the CAPIT application. Second thing was from my HOD when I did my cons and endo post graduation. Even here, I was very clear with her. I want it written, but I will write it, and you please correct it if you think something is too extreme. So when I wrote that, I made sure I have written things which actually happened. You know, we went to this program where we made a model which resembles the endomotor. So it was a failure, but then we didn't get demotivated. We came back, we tried it again, and we still displayed it in our endo chamber. So this is how we write it. Again, everything you can exaggerate a little bit. Yes, I'm not saying don't exaggerate anything, just be very truthful on paper. No, exaggerate, yes, you need it, but try to think. Every one of you who is here will have certain things that happen in the process of your dental phase, right? Some few incidents, just couple incidents, and just frame that story around that. So when I have told my HOD that I will write it for her, she was okay with it. Maybe some people may not be okay with it. So choose that person. Choose that person who is okay with you writing your letter of recommendation, because they don't have all the time in the world to sit down and write from the first line to last line. No, don't do that. Write it, send a copy to them, tell them if they want you to delete something or if they want you to add something. Always make sure in your LORs there is a percentage. Number is important. Like I was in the top 10% of my class. I was among the 6 students. She felt I was in the top 2. I've written it. I've made sure that she writes numbers. I've told her I need numbers on my papers because this is what I learned from other people. So LORs from India are worth it, but you just want to make sure how you're framing it, how you're writing it. And then the other LOR will be from the dentist you're working with here. If you're not a person who works here, if you're a person who is in India all the while, all the 3 LORs from the same background works, like Indian, all 3 Indians. But let's say one is an oral surgeon, one is a general dentist, the other is your dean of your dental school. So just make sure it's diverse, okay? It's not everybody, all prosthodontists writing for you or all endodontists writing for you. And what can we do to strengthen our resumes? Strengthen your resume. Again, be as much involved. If you're in the US, be as much involved as you can. Shadowing, assisting, preceptorships. Even if you don't have an assisting license, volunteer assisting. That's what I did because I didn't have a working license when I was dependent on my husband. and I worked as a volunteer in a dental assisting in a clinic. There are some free clinics that are present in every corner, and they serve free to patients, and that's where they take you in as a volunteer. So it is good that they know that you're being involved somehow. They don't, because when there is a gap in your resume, the first question you get is, what did you do all of this year? You can tell I had babies, you're fine, but you should have an answer for it. So, as I said, shadow, assist, volunteer, preceptorships, or also there are externships in some dental schools where it's just for 1 week, 2 weeks. And if you're so persistent in getting into one dental school, make sure you're showing your face to them if you're already in the US. Like, just go to the school, tell them, hey, I'm here to talk to the International Student Program Director. I just wanted some insight if I can. I can set up a time with her and go ask some genuine questions that you have. I want to learn this from school. Are you guys offering me? They will remember all of that. So this is the involvement you want. Strengthening your profile. Again, don't compare your profile with somebody else's profile. Very different. And I like to put any unique opportunities that you had, like where you presented some where you did some presentations and you won awards, put them there. They want to see those awards. Okay. DDS for becoming a dental anesthesiologist. Yes. So every state is different. In Colorado, yes, you need DDS to become a dental anesthesiologist. But I have seen dental anesthesiologists also being very happy with what they do because we work with some. But it is a very limited opportunities that you're looking at. But that's great that you're even thinking that route, because nobody usually thinks that route. And there are very limited programs or limited schools that offer this. So for you to be eligible for that program, you need to have a DDS here. Yes. Which department is best to grow? So endo, for sure. So it's, I think, the specialty is very different here. The specialists, they only perform the specialty procedures. Endodontist can only do endo procedures. And oral surgeon can only do the extractions and implants and all of that. So in my scenario, I work with endodontist and oral surgeon and periodontist for now. They all do fantastic. I think specialty here itself pays you more. If you're thinking on financially, specialty is almost double than what you get as a DDS. Like if you're getting 100,000 as a DDS, you're getting 200,000 as a specialty. So there is, according to me, endo, perio are the best here, because perio, it has a lot of exposure because people do a lot of surgical options for gums here. And also implants is a big thing for perio, right? So to me, endo and perio are the best. But if you want to like make a lot of money, ortho. Ortho is almost like a 3-year program to 4-year program, but the most money-making profession in the dental field in the US is orthodontist. But getting into that ortho school, again, you're gonna have limitations, right? So not tough. I've seen people get into it after DDS, but as per ortho, ideally they would like to have DDS. Endo and perio are something, even with the current profile, you can still apply to dental schools. So when you're applying to specialties, it's a whole different thing. Your SOP should be very different. Your SOP should be focused on why you want to become a periodontist and why don't you want to go through the DDS program here. What do you think that's special in you that you can directly jump from India to here and become a periodontist? So perio, I've seen a lot of people get in. Endo, very few. Prosto, 1 or 2 here and there. But oral surgery, none. Ortho, a couple. So this is what I have. GRE, at least to the 20 or 25 schools I applied, GRE was not a criteria. There were 1 or 2 schools where GRE was a criteria, but I didn't apply to those schools because I didn't want to give another exam again.
We will talk about that is the mathematics part data. On the middle side, other
Kaustav, can you put yourself on mute, please?
You'll remember when we discussed a lot about these drugs, which
Coaching for bench test, as I said, in California, I had 2 schools because I was here and it was 2020. I couldn't come back to India to take sessions. I had to invest that money here. I paid $4,000 here and I went to a Duggan Institute. And then there was Stevenson Institute, which are like in the same location, Los Angeles. And both of them are extremely wonderful. And right now, I think Duggan has gone down a little bit because the person who was teaching then is very, very old. But Stevenson, as of now, I've seen much growth there. Like he's fantastic. If you're in the US and you can't go back to India, you can just take that course, Stevenson. It is worth it. And tasks, most of the schools, basic class 2, a crown preparation. And these are the 2 most common things. And some ask you to do wax up, like they give you an inlay or onlay and they ask you to build the wax over it. And some schools are very extensive. Like, as I said, University of Washington, it had 9 different exams. Sorry, 9 different steps in the same exam. And do an access opening and do surveying on a cast. And do a crown prep, do a class 2 anterior filling, class 3 posterior amalgam, posterior composite. So almost 9 exams. So always be prepared for a class 2, a crown prep. These are the 2 things you can consistently keep working on. And the time limit is usually, at least for Colorado, like right now, what I see is for a class 2 and a crown prep, they do 2.5 hours. So you want to make sure you finish those 2 in that 2.5 hours and submit it to them. Research in the selection process, a very good question. I personally, as a postgraduate from India, I did research in like you know how post-graduation works in India. So I did my set of research there, but I wasn't keen on publications, or maybe I was lazy not to do publications. So because I wasn't thinking through all of this, I didn't have DDS in mind when I was doing my post-graduation. So I wanted to be a clinician always. So I wasn't much into the academic part. But here in the research, in the resume, research adds maybe 1% to overall profile, because now they know you sitting in the US, you can still get a research publication from India. So people who are judging you and judging your resume, trust me, 80% of them are Indians. They know what can happen. So if you have amazing research where you have publications in the International Endodontic Society or all of the American Association of Endodontics, all of that, then they may be like, oh, wow, this is huge. If they see publications in some random papers, they're not even considering it. Because when I spoke to the people here, they know that the research, if you give money, things are happening. So they don't want to trust and make a decision on the research. But if you already have good research, make sure you put it. Make sure you talk about it in your SOP. Because if you're really into it, tell them, I'm interested in research. That is why my publications show. And if you're interested in research, make sure at least one of your answers in your interview is related to it. So that now they know in your resume, the research is very important because you're already talking about it. So this is how research plays a role. Yes, then they think you're genuine and that adds more percentage. But if you just put some random publications here and there, Not very much. You don't have to, do or write false publications or just make publications for the sake of publications for your resume. What about OMFS? OMFS is the oral surgery that I was talking about. The reason oral surgery is tough here is, first of all, they mostly prefer DDS candidates. They are not going to take international candidates. Second thing, it's like a 4 to 5 year process, and it's a long process. Unless you're a 22-year-old graduate who's really coming, don't want to invest that time. I came here when I was 30, so I don't want to invest any time in further going on with specialty. So that is where I wanted to stop, because as a general practitioner, you can do whatever you want. You can take out impacted teeth, you can do endos, you can do orthos, maybe not ortho, sorry. You can do implants, anything you want as a general dentist if you have that skill. You don't have to be a specialist. The only reason why you want to be a specialist, take it from me, maybe for money. Okay? Or if you just want to be practicing only that skill, that is when you want to be a specialist. But otherwise, there is no much extra. If you already have the skill, there is no point in going back to school again and investing that money again, because specialties are not cheap too. You have to invest again money, right? So that's something, it's a lot of time you're thinking about. So just to reiterate again, or just to brief out, all I'm trying to say, if you want to take away something from this, personally, to me, what was important is my money and my time. Make sure you're investing your money now and you're getting admission faster. Invest in your bench test prep. Again, we have certain, even in India, there are certain good bench test preps. अरे मैं वीडियो लो ना, will you? I'm sorry for the break. Yeah, there are good bench test preps even in India. So yeah, you don't have to come all the way to the US. If you're in India, you don't have to fly all the way just to take these bench test courses, okay? You can do even in India because they have the same standard too, but make sure you're investing your time and money in that. The schools are very good at judging you in the bench. Residency or DDS. As I said, personally, I stopped with DDS because I didn't want to invest further time and further money into my residency program. But if you want to apply directly to residency instead of DDS, try perio or endo or prosto, if these are 3 things that you're interested in. But when you're applying to that, they want to make sure you invested some time in those departments prior to it. Directly from being a BDS, you can't just apply to being a prosthodontist here. You want to make sure you're coming here, doing some externships, doing some preceptorships, making sure what prostho looks like, because that is what goes into your SOP. SOP is statement of purpose. That is what goes there. That is what you tell your story, why you want to become a prosthodontist, why you want to become a prosthodontist in the US and not in India. So this is something very important. Don't apply for residency programs without having any background on it or without doing any research on it. AEGD, yes, I did consider AEGD in the beginning. I did my set of research for should I pursue AEGD or DDS, because AEGD is much economical, but the limitation to me was with AEGD, I can only practice in certain states. And with AEGD, you're not getting a DDS degree. So there are limitations when it comes to your job. There are limitations when it comes to in the future, when I want to move places or when I want to go somewhere else closer to my family. There's always a limitation. I have to stick to those certain states, which I didn't want to. If I wanted to move, I wanted to move. So that is why I took up DDS, but AEGD is also still considered by most of the international people because less fee structure, very less fee structure. hardly any theory subjects. It's all more clinical, and you come out and you still get a job just like a DDS. But as I said, it's limited to certain states where they can work as an AEGD. So if you're okay with those states, and in the future, if you think you may not even move or you may not even need DDS, fine, go with it, because it's still a very good deal. You still get the same amount of money as a DDS candidate. It's just how valuable is that DDS for you in the future. But otherwise, I did not dig deeper again. When I got this insight, I was like, okay, I'm not going for it, because I'm not. The first two criteria for me were having that DDS degree and me moving to places. So then that was out of my league. But if you are okay with those states, yes, that's a wonderful opportunity too. Mock tests. I did take Kaplan mock tests too. Again, they were very helpful. To take mock tests for TOEFL, for INBDE. I did do Kaplan. There were dental decks mock tests too when I did it. So I did both of them. And sorry, it has been 5 years that I prepared for my exam. There was also one app for NBDE. I don't remember the name of the app, but if I remember, I'll tell Raina or yeah, I don't remember that. But there was this app where I could download some mock exams and I could do the mock exams on my phone. But Kaplan Booster, I have never done the mock exams. I don't know if it was there when I was prepping, but Kaplan, I did it. And the reason why you want to take these mock exams is they frame the questions very similar to the final questions. I mean, the exam questions, because they look into it and they talk to people and they get to know what are the recent questions and all of that. Same thing for TOEFL. It's mostly representing the final exam. So try taking the mock tests. Other than Kaplan and dental decks, I didn't do anything else except that app. But if I notice anything that I hear from the recent grads, I'll let you know. Acceptance rate and criteria, as I said, I did not dig much deeper into it because I was not going for it. But to my knowledge, yes, INBDE is the only thing that you need to do in the TOEFL part. But the application process is very different. It's not through CAPIT. It's a whole different, like you apply to the schools individually. And the acceptance rate is tough for me to tell you because, as I said, I didn't go through that process. Yeah, books to read for preparation, as I told earlier, dental decks is the one that I read. So if you want to just stick to one book, stick to one book, any book. If you're already reading MDS CONQUER, do it. If you're reading First Aid, do it. If you're reading dental decks, do it. But stick to one book. I did dental decks personally. Any other questions for me? Okay. Yeah. So that's it I have for you guys today. So I just wanted to brief out everything. This is what will give you an insight at least. And I hope this helps you start somewhere if you already started. If you already started, you know which process are you in, but make sure you think about the time and money you're investing before moving here, before getting into DDS. Long term, think long term. That's very important. Where you want to settle down is important, because randomly don't make decisions. That's very important considering the visa considerations right now. So please be sure of what you're getting into. Okay. All right. If there are no further questions, I will hop off. I'll just be here for one more minute. Let's see if somebody has questions. If not.
Thank you, ma'am. It was a wonderful insight that you gave a beautiful experience of your own. So we know that it's a struggle process. I have my own friend who cleared orthodontics. She's gold medalist. Although being gold medalist, she's post clearance of NBDE both the exams by in the first step itself. She had to struggle a lot
Mhm.
for getting DDS, like
Yeah.
applications and everything. So we
Mhm.
should have that patience also, that in first go it's not possible that we may get admission in the university, because
Yeah.
there are a lot of criteria that they have. So, but
It's more than the criteria, it's also about the competition, because more and more people are moving here now. More and more people, they want to become dentists here. So that is the competition that's growing every year, right? So maybe this year is a good year because some people are still in a phase of what if the visa goes bad, what if this doesn't happen, that doesn't happen about the visa. So I think this year there may be less competition, but usually it's the competition that is the killer.
yeah. True. But your insights and your guidance and whatever your inputs are, I think they are, because how to present, how to write when the university, they ask lots of questions based on clinical questions and everything. In each and every subject, case based also, you have to give lots of answers and
Yeah.
clinical scenario when you apply to the university. So how
Mhm.
to apply, that is more important. And what you told right now is it's a great insight to them. So
Sure.
from, if they are preparing from now, okay, so if they are not publishing, maybe they are interested in publications right now, maybe that would add or
Yeah.
something like that. So even if they are doing
Mhm.
post graduation, then they will take up such kind of research work that is
Yeah,
uh,
exactly.
that makes a difference when the process of selection happens. Some randomized control
Mhm.
trial or some clinical uh, thesis research work or something that genuinely makes a difference, like that.
Yeah,
So
I agree with that. I totally agree with that. Like, just do what you're interested in doing. Don't do it for the sake of the profile, because that's not gonna help you at all.
yeah.
Don't talk to, I mean, I don't say don't talk to, but don't compare your resumes with others, because everybody's is different. Look at it, take a perspective, and that's it. Prepare your own.
yeah Hope nobody has any
Okay.
questions further. So thank you, ma'am, thank you all. So we will end the session here.
Sure. Thank
Okay,
you,
thank you,
Raina.
ma'am.
Thank you.
Thank you, ma'am.
Thank you. Mhm.